to yeah, perfect. Thank you for having me today. I'm I'm really it's one of the few opportunities I have to talk about the role of education and climate change and health. I feel like I spend a lot more time talking about the impact of the climate crisis on health. So this is a special opportunity. Climate change is posing an unparalleled threat to human health and well-being, and we do need to take urgent action to face this existential threat. So with this in mind today, I will begin with an overview of the human health impact of the climate crisis, including how climate change is helping drive significant health disparities. And then I will highlight promising solutions and opportunities for actions within the health sector, with a spotlight on education as a core solution and a discussion of the University of California Center for Climate Health and Equity. I want to start with a bit of a story. So on a holiday break back in the October of 2019, my family was excited to drive to Los Angeles for a visit. Some of you may be familiar with the drive on the 5 freeway. There is a high summit point at which the view of Los Angeles becomes visible and always indicates the end of a long drive between San Francisco and Los Angeles. And when we arrived at the top of the summit, we saw an orange glow in the distance. What we didn't realize was that we were driving toward a fire. What was the Silmar fire that year, which would soon be on both sides of the freeway, black and burning, flames flying at the car. Visibility through the smoke was almost none. So we, along with all the other cars that you see in the picture here, were barely moving. And there was a long time in which we were sure that we would be engulfed along with the other cars in the fire. What we didn't realize, because we were so focused on getting through the fire, was that our 13-year-old was crying hysterically, thinking that she would not make it out alive. We did make it through, and the fire was eventually put out, but my child couldn't sleep that night or the nights that ensued. And she's 17 now, and between June and November, she continues to have anxiety when there is a heat wave announcement. And the fear continues to impact her and many other young people around the world, where 152 of 196 countries have seen an increase in annual daily population exposure to wildfires. In their 2019 countdown, The Lancet notes, and I quote, that the life of every child born today will be profoundly affected by climate change. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. I don't think I need to tell this audience how dire the situation is. Projections of the widespread impacts of climate change are now made merely in terms of decades. We expect that there will be 200 million climate migrants by the year 2050. This means 1 out of 45 people in the world will have been displaced by climate change. Climate change is causing global hunger. It's estimated that 1 out of 9 people in the world are hungry, and that climate change will increase this number by 20 to 50% by mid-century. As much as 1/3 of the world population, so up to 3 billion people, will be living in dangerous extreme heat by 2070. And finally, it's estimated that climate change will reduce global economic output by 11 to 14% by mid-century, amounting to the loss of as much as $23 trillion. So the planetary health model that you see here asserts that the changes that result from human action, what we call anthropogenic change, has outstripped the resources available from the only habitable planet that we know. Human activities are driving fundamental change at a scale that hasn't existed in the history of our species. So Dr. Sam Myers at the Planetary Health Alliance created this useful schematic showing how this human disruption of our planet's natural systems shapes our health. So human activities, so what you see with the red arrow here, including our consumption patterns, are underlying drivers of fundamental ecological changes. These ecological changes or drivers include climate change, biodiversity loss, and each of these drivers interacts with others in complex ways to amplify and worsen their impacts. These serve as proximate causes that alter the air we breathe, the water we have access to, and the food we can produce. And rapidly changing environmental conditions also shape our exposures to outcomes such as infectious disease and natural hazards. And then mediating factors such as governance, wealth, these shape how populations experience the effects of disrupted natural systems. And finally, these changes ultimately affect every dimension of health and well-being. We're going to take a deeper dive into this model, starting with these ecological drivers. So the scale of our ecological footprint is enormous. Our consumption of fossil fuels has increased by 550% since 1950. We use nearly half of accessible fresh water and about half of the planet's livable surface to grow our food. We've dammed about 60% of the world's rivers and cleared nearly half of our temperate and tropical forest. And species extinction rates are 1,000 times higher than baseline rates. And these rapidly changing ecological drivers in turn impact the proximate causes that I just showed you in the planetary health schematic to influence every dimension of health and well-being. So what you see here from malnutrition, infectious disease, chronic disease, mental health, injuries, premature death. And I'm going to go into this very, very briefly, just to give you a sense. I'm going to talk a little bit about one particular kind of outcome, which is really heat and sort of how things are going to change over time. For a specific example relevant to most of us, because heat affects almost every part of the globe. It is responsible for more deaths in the US than all other weather-related disasters. The harmful health effects of heat are, of course, well documented, ranging from mild discomfort, heat stress, heat stroke, worsening pre-existing chronic disease and mental health conditions. From 2000 to 2018, heat wave exposure among the elderly has increased by 57%, and it's going up. And globally, increasing average temperatures mean that the average temperature of record hot weather will become hotter and hotter over time. And no understanding of the climate and health crisis would be complete without acknowledging how it drives significant health disparities. So the most vulnerable regions and populations throughout the world are at most risk of climate exposures and impacts, including already areas that have high levels of food insecurity, poverty, and existing large disease burdens. Vulnerable communities around the world are the most susceptible to climate risks, including migrants, people of color, the elderly, and children. And the bottom line is that climate change intersects with structural injustices to exacerbate existing disparities, leading those who contribute the least to greenhouse gas emissions to suffer first and worst from its harmful effects. And this is what we often call the climate gap. So these two maps show how glaring the gap is, the climate gap is. So on the bottom left, we see that countries with the highest per capita carbon dioxide emissions, what we call the greatest consumers, so the US, Canada, Australia, Russia, also have the lowest mortality linked to climate change, shown in the top right map. Meanwhile, areas with the lowest per capita emissions, such as South America and Africa, suffer some of the highest climate-related mortality rates. And we see the climate gap in the context of extreme heat. So for example, in Los Angeles, we know that Black communities are twice as likely to die from heat waves compared to other residents. Agricultural workers are 35 times more likely to die due to occupational heat exposure. In a study of over 100 American cities, formerly redlined neighborhoods are now 5 degrees hotter on average during the summer. And these neighborhoods have less access to air conditioning, and they have fewer trees and more paved surfaces that trap and radiate heat. And this is what we know and call the heat island effect. And substantial disparities also exist in wildfires. So while white communities tend to have more exposure to ambient particulate matter 2.5 from wildfire smoke, communities of color and low wealth communities experience more individual exposure via high infiltration smoke pollutants into their homes. And given that people of color already experience disproportionately more air pollution as a result of environmental racism, these wildfire smoke effects have the potential to exacerbate already existing health disparities within these communities. And the climate gap we also see emerges in extreme weather events like hurricanes, flooding. The key US extreme events you see represented here have all included disparities in injury and fatality rates and long-term economic impacts associated with displacement and livelihood disruption. Okay, so that gives you sort of the larger context for what is happening across the Earth. But now I'd like to really turn to the more hopeful part of this discussion, which is to focus on solutions, because there is a lot that we can do in how we try to tackle climate change and how it's affecting human health and well-being. And according to one of the original Lancet and Commission Lancet countdowns on health, this is from the early years, acting on climate change can be the greatest threat, but also the greatest global health opportunity of the 21st century. And this is because we know that climate solutions have many critical health co-benefits. For example, we know that decreasing fossil fuel emissions by driving less will decrease the 7 million deaths a year attributed to air pollution and the 5 million deaths linked to physical inactivity. And the health sector has a very critical role to play here. So while in the past year, we've seen a huge increase in the health sector's action on climate, we need to do much more than what we're doing. Recently, the Department of Health and Human Services put forward 8 critical areas of the health sector in working towards climate change solutions. And to name a few, these include advancing knowledge on climate health equity links, building a health-based climate adaptation and resilience, advancing health equity and climate justice, and building a climate-ready health workforce. And I'm actually going to take a deep dive into the very first area, which is the advanced knowledge on climate health equity links, which is really the education part of it. And the primary area, sort of what I really believe is one of the most fundamental core solutions. And just to note that equity is going to have to be a critical thread to all this work, integrated through all types of solutions. So before we go into sort of the education piece of it, there is one thing that we do need to acknowledge is that the health sector is in a unique position to advance climate action. So first of all, health professionals are already on the front lines of climate change, treating patients in affected communities for climate-sensitive illnesses and injuries. Also, the ties that the health providers and health systems have with local communities can make them strong community anchors for building climate health resilience. The health sector has a substantial carbon footprint itself, and so it's long overdue that the sector transforms itself from a climate contributor to a climate steward. In particularly in view of the oath that health professionals take to do first no harm. As we think about education as a core solution, so like I mentioned, health professionals have always been on the front lines of advocating for solutions to the world's most pressing public health concerns. The health science community has a vital role to play in tackling climate change. We need to ensure learners at all levels of the education continuum, starting from students, residents, fellows, to faculty and healthcare providers and practitioners, reflect on their role and responsibility in combating the health effects of the climate crisis. The history of education, if we look back on this, has pointed to the fact that education plays a vital role in instigating societal change. So for instance, we know from years and years of research that higher education is linked to tolerance, prosperity, civic engagement. In addition, research has shown that educational institutions in and of themselves play a critical role in leading that transformative change and progress in society. So we really want our healthcare institutions to provide an education that prepares our learners for what we call environmental accountability, which is the idea that our institutions' education, research, service activities develop, promote, and protect environmentally sustainable solutions to address the health concerns of the communities that they serve. So as one solution, we did a little bit of early work to help identify how to increase climate and health knowledge uptake by learners in the health profession settings. In order for learners to really comprehend the impact of global environmental change on patient care, connecting these changes to local community health is paramount. Through a worldwide study with climate health and justice experts, we found three facets were necessary to ensure education for climate and health is relevant to the local context. These three facets are community involvement, so students become familiar with real world, locally relevant issues by identifying opportunities for engagement with community members. For example, there is a school that has rolled out an educational project in which they really have students work on pulmonary function testing for individuals living near areas affected by wildfires. The second component is curricular changes that involve community. So inviting community leaders and patients to educate learners and play a role in that design of education. And then thirdly is education partnerships with local organizations and communities. So exemplar partnerships that we've seen include those such as the ones in Brazil, in which learners are linked with local farmers to provide fresher pesticide-free foods at the hospitals, thus reducing food miles and carbon emissions at the same time. Now, faculty in the health profession, schools with expertise in climate change and health are needed to ensure this education can happen. But the current landscape assessment shows that expertise in climate and health is lacking among faculty. For example, recent research by Denver and colleagues has identified that most physicians feel that conversations about the health impacts of climate change should become a part of clinical encounters, primarily to help patients protect their own health. But it was also highlighted that physicians note that they need the knowledge and skills on how to make the patient care conversations about this topic relevant and actionable. So building on this gap, we designed and implemented the Climate and Health Faculty Development Initiative. Our goal was to educate, engage, support, and inspire health science faculty members to infuse climate and health into their ongoing teaching, transform courses, and ultimately the education of learners. Using a train the trainer model, we trained 10 faculty leads and 96 faculty members across the 6 University of California health science campuses to integrate climate change and health into their courses. Overall, 99 courses were transformed and over 7,000 students were reached across all the health science schools, such as medicine, veterinary medicine, nursing, pharmacy, and dentistry. And while we focused our effort on a university system-wide initiative, the model that we really proposed is transferable to other institutions. And of note, I really want to mention that Greenwald and her team at Sinai conducted a retrospective examination of the implementation of a similar integrated model for curriculum delivery. And they sort of look back four years post-implementation at the School of Medicine, and among many results found that the content lived on in the curriculum for the most part, and with some very nice set of priorities for where this education needs to go next in terms of sort of a shared vision of centralization of content, professional development of faculty, very similar to what the literature shows, and really the involvement of summative assessment for students and the content itself to ensure longevity. I want to highlight another neat and quite popular educational intervention that we ran specifically at UCSF, which was focused on educating the community about key climate and health and equity issues. The UCSF Osher Mini Medical School for the Public gives members of the community an opportunity to see and hear what goes on in UCSF's everyday classrooms and research labs with lectures from UCSF faculty. And led by 2 of our faculty members, we rolled out a series of 6 topics that you see here, which were covered, included, the health emergency of our changing climate, climate change in the era of COVID, and the mental health impacts of climate change. And it was quite popular. We were oversubscribed. Lots of community members joined this event, and we hope to roll this out again in 2023. I want to underscore a very neat initiative prompted primarily by medical students around the country. The Interview Without Harm Coalition initiative represents a group of passionate medical students, residents, and faculty who envision a sustainable and equitable and efficient process of interviewing medical trainees. This campaign, which actually built on a similar one in Canada, provides an opportunity for students, faculty, and program directors to see how much greenhouse gases they are emitting or not while traveling for interviews, and centers the consideration of the environmental impact into ongoing practices in medical education that have often been taken for granted. So AKA our interviews, for all aspects of medical school, residency, fellowship. The initiative joins evolving conversations on the forced restriction of medical training interviews caused by COVID-19 pandemic, underscoring how the professions have really not prioritized the environmental impact, despite the sizable historic emissions generated by interview-related travel and the incompatibility between ecological damage and population health. Beyond environmental impact, the initiative hones in on how virtual interviews are in fact more equitable, with significantly fewer financial costs, and are more efficient, requiring less time off from school or work. Many concerns associated with virtual interviews, including interview inflation and limited applicant exposure to programs and their surrounding areas. And it speaks about how that can be addressed via creative and structural solutions, such as interview caps or in-person second look programs. And this initiative represents a very important strategic inflection point for medical education leadership to build on the momentum and permanently transform the process by focusing on equity and sustainability. I want to highlight many novel education efforts around the world. What you're seeing here are some key innovations in education around climate and health. For example, the Planetary Health Report Card, founded by Carly Hampshire, who was one of our UCSF Center Fellows, is a student-driven, metric-based initiative to inspire planetary health education engagement in medical schools and is now used globally. It's really an excellent needs assessment. And we're rolling it out right now across all of the 20 health profession schools in the University of California system, so they can identify where they're at and where they need to go. The Global Consortium on Climate and Health Education at Columbia works with health professional schools around the world to develop a core global knowledge set and model curricula to prepare health professionals to face climate and health impacts. It is a fantastic resource. Almost no faculty members should have to go and develop anything from start if they check the Global Consortium site. I also want to highlight the Center for Sustainable Healthcare Education. This is one of the first initiatives on climate change and health out of the UK General Medical Council that was formed, also a great repository of information. And then the Association of American Medical Education in Europe has also committed to this work and has a series of papers and educational resources that are very helpful. And finally, the nurses database is very similar to the Global Consortium. It was a European Union funded effort to provide a curriculum repository for nurses around the globe, also a very powerful and useful educational resource. And then I also want to highlight novel training programs in climate and health, with a number of these programs growing. So, for example, University of Colorado School of Medicine inaugurated the nation's first graduate medical education fellowship in climate and health science policy, with its goal is really to train credible, knowledgeable health leaders in the clinical, basic science, and policy settings. The Climate and Health Organizing Fellows Program is a joint effort between the Cambridge Health Alliance and Harvard Medical School, which really develops a cadre of health professionals to advance climate solutions, with a focus on learning about sort of the health equity implications of climate change, and really developing durable community organizing skills that create structural change. It's a pretty nifty and novel program. I want to turn to talking a little bit about the University of California Center for Climate Health and Equity. We, with the support of an amazing team, received funding from the University of California Office of the President and the UCSF Chancellor to launch this new center, which was launched in July of 2021. The center is housed at UCSF, and it has a mission to harness the expertise and leadership of the health sector to drive climate action for health and health action for the climate. Ultimately, our vision is to advance equitable and just climate solutions that promote human health and a healthy planet. We work within 4 strategic work streams you see here: research, education, health systems, and policy. And then we have certain special initiatives in the center. One of our core and very wide-reaching initiative is our University of California Climate Change and Mental Health Council. The center brings together faculty, staff, and students from all 10 University of California campuses and 5 healthcare systems to really focus on climate solutions. We have over 100 faculty affiliates that lead education research and solutions on all aspects of climate change and health. And our approach really focuses on leveraging the expertise and resources and innovation within the University of California system, centering community perspectives and needs through an equity and justice lens, which we bring to all of our work, collaborating with civil society and government sectors to sort of amplify synergies and make sure that our impact is useful and helpful to that larger dialogue, and then implementing a needs-driven and policy-responsive agenda that really provides rapid and tangible benefits, not just to California, but really globally. Our impact has been in the 4 key areas here, and I'm going to really delve into these 4 areas a little bit more, but I won't actually go through every area, more so than focus on the education aspect of the center, which is a pillar of its own, but also interweaves through all the other pillars, including research, policy, and health systems. So we are really leveraging education to drive change with the goal of building an education hub on climate and health. Last year, we launched a course on climate and health justice at UCSF, and the class in and of itself wasn't entirely novel, except that the faculty member who led it leveraged new ways of getting the word out, including working with students to make sure that they produced op-eds. They worked on creating social media videos of their work to maximize impact. And the course has now been rolled out across the UC system. A group of students worked on creating patient care materials, what we called our Wildfires Hub, which is now housed online. And these patient care education materials are available in English, Spanish, and Mandarin, and they really go through the general health risks associated with wildfires, as well as the impact on sort of lungs, heart, pregnancy, skin, mental health, and really are meant to be a tool that any clinician can use in dialogue with patients. This year, we will be running a student ambassadorship program for climate and health, where we will support student faculty pairs to develop climate and health content to integrate into health professions education. And then we have a paramedicine course that we're beginning to launch to train first responders on how to address climate and health emergencies, and a course on climate health and climate and mental health resilience, which really engages students in understanding sort of climate despair, climate anxiety, and how you channel that into climate activism as a way to address eco-anxiety. Our research pillar has done a lot of work this year, but the one piece I want to highlight is that last year we launched a UC-wide seed grant program, which funded a list of projects, including, sort of climate resilience efforts in Central Valley of California. But the one project that was education focused that we are very excited to hear more about at the end of the project, which will be mid-2023, is a project out of UC Berkeley that focuses on documenting the traditional ecological knowledge of Indigenous communities and supporting the incorporation of this knowledge into education interventions among health professionals. We are accelerating ways of thinking about building climate resilient health systems by greening our health systems and ensuring that the public health infrastructure and our clinical systems are prepared for acute and long-term climate health threats. Of note, sort of in education here, we're launching a clinical sustainability fellowship, what we're calling our decarbonization fellowship. It's the first of its kind in the US. It'll support faculty-led decarb projects across the healthcare systems in the University of California and medical specialties, in which faculty will work to decarbonize their particular specialty. Finally, we're working really to create a climate and health community of practice by convening and supporting faculty and staff. We have faculty and staff from outside of the UC system who also engage in our work. And this year, we also started really a new cadre of 8, what we call our center CCHE fellows that come from across the University of California system. As I close out, I want to leave you with a way to think about how we can really answer this never-ending question of what should I do? So Dr. Ayanna Elizabeth Johnson is a marine biologist and the founder of the not-for-profit think tank, the Urban Ocean Lab, and she's also founded the climate initiative. It's called the All We Can Save Project. She raises and makes a powerful case for nurturing a welcoming, connected, and leader-led climate community that's rooted in the work and wisdom of women and justice to focus on the planet and saving it. I often think about her framing and the goal of this diagram, which really is to begin to foster a dialogue that connects and inspires you as health professionals and helps you identify your purpose and actions to take to work towards this purpose. As we think about sort of change, we have to think about it in the context of these 3 circles. So the number 1 circle is, what are you good at? So what are your special skills, your magic? So as you think about your role as an educator, an education practitioner, a researcher, clinician, really what are the special talents and gifts that you bring to your profession? The second area to think about is what brings you joy professionally, what gets you up in the morning. Very important, she argues, is that neglecting joy will lead to burnout. So personally, for example, as I think about what brings me joy is really getting up in the morning and working towards climate action and climate justice and trying to address that. So as you think about the climate crisis, sort of where you would want to land within what brings you joy. And then the final component is really what's the work that needs doing in healthcare? What are the climate and justice solutions that you can work towards? So really thinking about the solutions that you can then there in terms sort of impact and change. And so take a moment to think about and reflect on the intersection of the 3, and that will point you to what you should do and what you can do, how you might focus your actions and efforts, and how you might change your current approach to include and change some of the dialogue around climate change and equity. So in light of that, thank you, everybody, and I'm going to stop sharing and I'm happy to answer questions.